Welcome back to News First. The Guam Department of Public Health and Social Services confirmed today that a second person with locally acquired dengue infection was identified after being seen at the Guam Memorial Hospital ER. The individual is an adult male who resides along Swamp Road, Dededo. Public Health said it's operating on a two-pronged approach in its fight against dengue, activating a medical and mosquito surveillance team as part of its concerted efforts to control the spread of the virus on Guam. Following its first interagency meeting yesterday, Public Health Director Linda DeNorsi said that after wrapping up fumigation at the two schools in Ordot Chalampago, the teams will continue spraying insecticides within the 200-meter radius of the dengue-infected person's residence. The mosquito surveillance teams will also continue gathering laboratory samples and testing them for the presence of the virus. Chief Environmental Public Health Officer Tom Nadeau shares more about this process.
Our team is conducting mosquito surveillance and mosquito control. So that entails that we essentially capture mosquitoes in the area of interest and we identify them.
Okay.
Then we test them to see if they carry the dengue virus.
Okay.
And I'm here to share with you that so far our test has shown that none of the adult mosquitoes that we captured has tested positive for dengue virus. The individual who was tested positive for dengue, who had no travel outside the island. The individual does reside in the village of Manila, so we've heightened our surveillance and control measures in around that neighborhood. And that individual does attend Aga Johnson Middle School. That's why they were included as part of the heightened surveillance and control, and not the spraying of the pesticide.
Meanwhile, Dr. Ann Pobutsky, the territorial epidemiologist, reports on the progress so far of the medical surveillance team. Pobutsky said while mosquito lab tests have turned out negative, it is still too early to tell. She said the medical team is tasked to do increased surveillance on any suspect, active or additional dengue fever cases.
As we do the field work in the area, we're also doing surveillance for anybody who's sick with a dengue-like illness.
Okay.
Those people would be asked to be tested.
We're anticipating that there is a possibility that there will be more cases.
Public Health said it is working closely with the Centers for Disease Control and Prevention and other partners to minimize the spread of the dengue virus. In related news, since the governor declared a state of emergency to prevent an outbreak of dengue fever on the island, several government agencies have been working vigorously within the past few days to provide outreach to the community. Let's check in with PNC's Amanda Dedicatoria for more.
Over the last few days, officials from the Department of Public Health and Social Services have been surveying the residences of the 83 homes identified to be high risk and within the 200-meter radius of the infected household to issue pamphlets about dengue fever, as well as offer for their properties to be sprayed with insecticide. As of today, 53 homes have been visited and 12 residents have consented for their properties to be sprayed in order to prevent the spread of the disease. According to Bertha Tyron, a public health program coordinator, some of the issues that the members of the outreach team have faced involve accessibility to the residences.
Some of the challenges that they're facing, of course, is the stray dog population. So they just leave the pamphlets maybe on the fence or somewhere where the residents can see it. So those are the things that are going on today. This afternoon, they went back into the homes and they're visiting the remaining homes that they didn't visit, and also the homes where the people were not home.
In addition, the Mayor's Council of Guam were given several posters and pamphlets concerning preventative information for the island's mayors to distribute to their constituents. Public Health is also working to conduct presentations with the island's public and private health providers concerning the signs of the disease. According to Linda DeNorsi, the Director of Public Health, the department has also reached out to the Center for Disease Control to request for their assistance to analyze the strain of dengue present on the island.
We want to compare the virus that's in the mosquito with the virus that's in the patient's human sample, so that we can compare the virus off the Guam's mosquito population with those that are around the Pacific Islands to see if it's the same type of virus.
Dinorsi stresses that dengue is not a communicable disease and can only be spread via mosquito from someone who is infected to an uninfected person. She says that the transmission of the disease is controllable and encourages the public to discard debris that could act as potential breeding grounds for mosquitoes, such as tires or containers. Amanda Dedicatoria, Pnc News.
Thanks, Amanda, for that report. For concerns related to the dengue fever outreach, please contact the Mosquito Surveillance and Control Program at 735-2221. In other news, switching over to news from the CNMI, Mobile Marianas has launched its new Synergy Fuels in Saipan.
You ready? Let's count down together. Ladies and gentlemen, in 3, 2, 1.
The launch event took place at the Middle Road Mobile this morning. The improved fuel formulations with increased additives are now at all 11 service stations in Saipan. Guam also launched the new Mobile Synergy Fuels program earlier this year. As part of the new offerings, Mobile will be investing in upgrading its image so customers can experience more attractive and brighter stations in Saipan. Mobile Oil Mariana Islands President Jimmy Howe says the Synergy fuel technology helps customers get more out of their drives.
Our Synergy range of gasoline is backed by extensive technological innovation and designed to help ensure that the customers get the best performance and driving experience.
Our very own Kyle Mandapat hosted the launch with PNC's Joycelyn Atlick, also covering the event. Well, up next, your daily dose of Life in Balance.
Life in Balance is brought to you by Community First Guam Federal Credit Union, your Good Neighbor Pharmacies, Simply Food, and Guam Regional Medical City, where patients are partners.
What you're seeing now is the same plastic catheter we were looking at. If you look carefully, you can see that there's a tiny metal line there. That's a wire that goes through the area of blockage with the tip of the wire out over here. And this is a stent which is mounted on a balloon. When the balloon is inflated, the stent is implanted deep into the wall of the artery. The patient's pain went away as soon as we opened the artery. And the really good news is that she got here early enough, and this is not so much our credit but hers, is she came soon enough that we were able to open the artery soon enough that the pictures that we took of her heart muscle at the end of the procedure showed that there was no damage, no visible damage done at all. So as a general teaching point, if you have chest pain, come immediately. The longer you wait, even if we get the artery open, the longer you wait before you show up, the more damage will be done.
All I can say, he is actually a guardian angel of mine. And I actually had a massive heart attack. He saved me.
Look at her, she doesn't have any more shortness of breath. She's not tired anymore, you know.
Did you make the right decision?
I made the right decision.
So what we're trying to build is a full 24-hour, 7-day-a-week STEMI program so that anybody who has a heart attack anywhere on the island of Guam will be brought directly here and have their artery opened at the time of the heart attack instead of relying on unreliable medications or drugs that might be partially successful.
To learn more about the GRMC STEMI program, call us at 645-5500.
Leo Payumo scores a touchdown with high school football action a little later in the newscast, but up first, we have Destiny Cruz standing by with your PNC weather report. Destiny, take it away.
Happy day, Marianas. Welcome to your local weather report. I'm Destiny Cruz and thanks for tuning in. Today, the usual cloudy skies accompanied by isolated showers and thunderstorms made their appearances as light southwest winds blew at 5 to 10 miles per hour. Tonight, we can expect our lows to be at a comfortable 78 degrees as a surface ridge separating the monsoon extends into the central Pacific east of the Marianas. This feature will cause winds to decrease as it approaches tonight and tomorrow. Increased cloudiness throughout today should limit the island effect convection, bringing only isolated showers and thunderstorms tonight. Moving into Wednesday, we can expect mostly cloudy skies with scattered showers and thunderstorms. North winds will blow through the Marianas at 5 to 10 miles per hour, and highs are expected to be at around 86 degrees and lows around 78. On Thursday, we can expect partly sunny skies accompanied by isolated showers and thunderstorms. Northeast winds will be from 10 to 15 miles per hour, with their highs around 88 degrees. If you were planning on heading to the beach throughout this week, please remember that rip currents and high surf advisories still remain in effect for Guam. Avoid hazardous sea conditions until advisories are lifted. And that's all for today's weather report. Have a safe rest of the evening and be sure to tune in next time for more updates. Adios!